Hey there, it's Dr. Earl Stephenson, Jr., board certified plastic surgeon here in Atlanta. And patients from around the world ask me questions through a community called Real Self. It's a plastic surgery centric community where they can get information from plastic surgeons globally as to their concerns or questions. And I wanted to share here with you how I evaluate problems, think through solutions, and guide patients towards safe and natural outcomes. With that being in mind, let's talk about today's question. Today's question, patient asks, can fat nodules from transfer be removed without a facelift? So let's bring up her picture. This is the picture that this patient submitted to Real Self, and I answered, among other plastic surgeons. And so you can see she's pointing out areas that it's hard to pick up on the pictures that are, I guess, contour deformities or lumps or nodules or bumps that are probably representative of fat transfer. Now, why somebody would have fat transferred to the forehead, maybe it was more toward the temple, but I don't know. She's looking at her upper eyelid. Sometimes fat transfer is done in that particular area when people have deep hollows or deep recesses. So, fat transfer to the face in various areas is certainly an acceptable procedure. And I'll say this just like I say for every procedure, if the candidate or the patient is appropriate from a physical standpoint, from a health standpoint, and most importantly, from a expectation standpoint. So, how did I answer this question? You know, basically, if I look at the face, it contains, a delicate array of nerves that are important, facial vessels, blood vessels that are important. Aggressive surgery or random incisions or cuts in the area sometimes can make these areas that are nodular kind of worse or they can enhance the contour problem because now we've added a surgical incision in an area that's probably not the best area or the most suitable area for an aesthetic approach to resolve this problem. So, depending on the severity of this particular patient's issue, and I would classify this based on what I'm seeing in the picture as mild to moderate at best. That's my interpretations. Patients have an interpretation of from themselves because it can cause a lot of psychological issues, angst, anxiety, so on and so forth. So they would classify it as moderate or severe more than likely. But with that being said, I think she has a couple of options. One, you can use kind of conservative contouring. You can get specialized small cannulas and effectively low volume, low suction, liposuction these areas. And a cannula is just basically a metal straw. So you can make a little stab incision maybe in the hairline so you can hide that. You can kind of creep down if we want to use this one in the forehead as an example and see if you can truly liposuction and bring down that contour so it's flush with the surrounding area. So that's one way you can treat it. You can treat this medically without any type of, you know, direct intervention. Sometimes steroid injections can help melt, dissolve the hardened fat and improve the contour. But you have to be careful. It's a slippery slope. Steroids can certainly melt and kind of soften fat, but it can also affect skin if you are injecting this at high powered doses of steroids or injecting it too frequently with steroids. It can cause the skin to become really thin, crepey, and almost like tissue paper. So there's a fine balance there. You can try a camouflage approach. You can basically try to put a little fat around there to try to help that. I don't think that was to be the best option, but that's something to think about as well. But this is an unusual problem. I think if this were truly my patient, I think we would start with a low dose steroid injection and try to really reduce that, try to balance that against what the steroids may do to the overlying skin. Certainly, we can go to a limited surgical incision just over that area, very limited to try to reduce the bulk, not try to remove everything because that may produce a contour a deformity, which will worsen the problem or create a new problem. If the area was really, really soft and not firm, these areas are typically firm when they form nodules. But if this were really soft, I would also give a strong consideration to using those fine tipped cannulas to see if I can liposuction or bring down some of that fullness to make the contour more balanced. So that would be my answer to that question. I hope you've enjoyed that insight. If you're thinking about exploring any type of facial rejuvenation or even facial revision surgery, such as in this case, feel free to kind of download the free natural rejuvenation guide here. If you just click the link in the video description below, we'll get your information and we'll send you that rejuvenation guide. So until next time, I thank you for watching, and this is Dr. Earl Stephenson Jr. at ESJ Aesthetics, where confidence takes shape. See you soon.